We have a Krispy Kreme on 163rd Street. When we used to get off work at 2 o'clock in the morning, I'd wait for the sign to flash hot and ready. And I'd be in a parking lot with a half a gallon of chocolate milk, and I'd pick up 2 dozen of Krispy Kremes. I'd eat a dozen in a parking lot, and I'd bring home the other dozen and eat them when I got home.
I'm Melanie, and I'm from Philadelphia. Well, I had been thinking that I wanted to get a lap band, and I went on to some of the websites and was looking for who is a good surgeon in South Florida, and I kept hearing on these websites about Dr. Cohen.
My specialty is in general surgery and in specifics laparoscopy, advanced laparoscopy. We do a lot of weight loss surgery. I've been part of the Memorial system now for about 9 years. Did my training down here at the University of Miami, general surgery, and then I did a fellowship in advanced laparoscopy. I did it out at the University of Southern California in LA. When my partner and I were looking for a place to really start a formal laparoscopic program, a bariatric program, we knew we needed a hospital system that was really committed to what we were trying to do. Kind of a powerful system in the area, a lot of good resources, availability for patients, because a lot of the patients that we take care of have pretty special needs.
The main contributing factor to me to lose the weight was my doctor wanted me on 2 more medications. I was already on 9 medications to begin with, so I was actually taking medications for the side effects of other medication. So I was like, okay, enough's enough, and that's when I realized, I finally looked at myself in the mirror and said, something needs to drastically change. I had a gastric sleeve. Basically, they take your stomach, they cut 85% of your stomach away, and they shape it to the size of a banana. Roughly, you can hold between 3 to 4 ounces of food in it at one time.
We offer kind of an advanced laparoscopic approach to most operations that I think benefits patients a lot.
Employees of Dr. Cohen's that are seeing this type of thing every day then choose that hospital and that doctor for their own surgery and for their own well-being. That really said a lot to me.
Weight loss surgery is one of those fields where we do an amazing amount of good for patients. They really, really benefit dramatically from it. Someone that gets back to the things they've wanted to do their entire life, getting rid of medical problems, being able to be with their family, enjoying in what we would consider a normal life that they've been restricted from. Talk about patients that have had things like reflux disease, to hear them come back and say it's gone. Well, one thing that Memorial really does provide, and when you talk to patients that have been through other systems, is it's really kind of a global care system. They take care of patients from the moment they become part of the system. So it's taking care of the patients' families, not just their medical needs, but everything else that goes around it. And it's one thing that Memorial has done a very good job with is getting everybody on the same page, everybody with the same goal. And the goal is to make sure the patient has a successful and a good experience coming through a difficult time.
I was close to 500 pounds. Now I'm right around 230.
I was 220 and a size 20, and now I'm 135 and a size 6. My in-laws at Thanksgiving this year told me this is the best I've ever looked. So that was really felt good to hear that.
I consider my surgery date my rebirth, so to speak. I've got a new lease on life, and I do things now I didn't think I'd ever do.
Someone comes back and says, you gave me my life back. I mean, that's something I think would be difficult to equal somewhere else.
For 2 years in a row now, because I've lost so much weight, I've actually on top of the roof putting on Christmas lights, and now all my neighbors are just laughing because I never used to do it. Now I can do it.